Okay, welcome to this UK drug testing presentation about drug testing in schools. And what we've got here, we're going to show you today, is a couple of the options that we think are appropriate and been designed to try and give you a simple and easy testing solution system that can be implemented quickly and relatively cheaply. Gives you the ability to identify if there is a problem and move forward from there. So we've got a couple of tests on display in front of you here. First one here is an all-test 10-panel drug screen, which is a urine dip test. These can be purchased either individually or in combination with a urine collection cup, such as this green self-locking lid cup system. And on the right here we've got a design of saliva drug test, which would be an alternative choice. Now we're going to talk a little bit first about what's the best route for screening saliva or urine. Okay, now this saliva test is very easy. It's basically a swab on a stick that is presented to the candidate that you want to sample, put directly into the mouth, and you simply get them to saturate this white sponge with saliva. By screwing the two components together, you discharge that sponge into the base of the test here, sit that upright, and you get anything up to 11 drugs plus alcohol screened within 5 minutes. Now the combinations on offer are more directed towards workplace or employment screening and healthcare screening than schools, but it's a very good 11 drug combination. Includes cannabis, cocaine, some of the sedative tranquilizers, amphetamine, ecstasy, and methamphetamine. Okay, what it doesn't include, and what is an option on the urine test, which is this panel here, which is the 10 panel with ketamine and cotinine. This allows the single test to be screened for the following 10 drugs. So you're screening for opiates and heroin, ecstasy, you're screening for cocaine and crack cocaine, cannabis, amphetamine, methamphetamine, synthetic cannabis or K2, benzodiazepine tranquilizers, ketamine, which is increasingly widespread amongst the demographic that you're looking at. Cotinine is a nicotine first-line metabolite, so this test will also screen them for if they've been smoking, so appropriate in a younger age group perhaps. This test is ideal because it does combine most of the common recreational drugs of abuse, including the two modern ones on there, which are good to screen for, which is the synthetic cannabis in addition to the cannabis, and the ketamine, which is an increasingly problematic plug drug. Now the design on this test, if we open it up to demonstrate it for you, is a single panel design, prongs coming out the bottom, 5 on one side, 5 on the other. The drug abbreviation codes are along the top here in the panel, and you're looking for the presence of a test line with a control line. Very easy to interpret your results. Positive is indicated by the presence of a control line but complete absence of the test line at the read time, and a negative is indicated by both control and test line showing. You'll see this is designed nicely to dip into the cups, which can be purchased with them, and these only need to be dipped in the urine sample for a matter of 5 to 10 seconds. They can then be removed and resheathed, and then this can be laid flat, and you can read this at between 5 and 10 minutes. So that will give you instant results for those 10 common drug bupes, positive or negative for each. Allows you to identify individual problems or multiple problems where they've been consumed in combination. And the same with the saliva swab test, the DSD 812-7. Basically that will give you 11 drug test results, either positive or negative, at 5 minutes, and the 812-7 will also give you a saliva indication of whether alcohol is present in their blood or not. It's a direct correlation between the saliva level of alcohol and the blood alcohol concentration at the time of testing. So any change on that saliva alcohol pad, that's an additional test that's available through the saliva. If you want to add that in as a separate test onto the urine test, you can purchase either breath alcohol screens that single use, just blow through it with cut-offs, give you an indication of the level of alcohol at the time of testing, or a saliva dab test, which is added in in addition to the urine sample that you're collecting. Now, the window period for which these tests will detect drugs is of importance and interest to you, okay? You may be drawn towards the saliva test because of the ease of sample collection, the lack of embarrassment, and lack of having to handle a urine sample. However, if you do so, you get all those advantages, but you also get a much shorter window period for detection drugs after they've been used. And for particular drugs such as cocaine or cannabis, the cannabis can be as short as 12 to 14 hours after it's been used, and cocaine 24 hours to 36 hours after it's been used. If you compare that to the comparative urine sample tests, for most of these drug groups you are looking at a window for detection after exposure of between 3 and up to 5 days. And it can be longer after sustained use, or with the benzos, if it's a long-acting half-life or a long half-life benzo, can stay in the system and still be detected in the urine through the metabolites for a very much longer period of time. But that needs considering when you're doing these tests. If you've got somebody that you consider has just taken a drug, is still under the influence, you want to screen them, what's in their system right now, saliva is ideal. If you want to check somebody on a random basis, on suspicion, where you think they may have consumed something a couple of days ago, then you really should consider the urine test as the best option, okay? Now, both these products are available from UK Drug Testing. The panel test, the saliva test, and the urine cups in the add-on items will be perfectly adequate. You need to look at what the combination is on the test you're buying. If it's just a specific or single drug that you're looking to screen for, then you don't have to buy the panel or combination tests. You can just buy specific urine screens or strip tests that will just give you a positive or negative for a single drug group, and that might be all you need, okay? But we would suggest, if you're doing a screening program, that you look for multiple combinations, and the cheapest way of doing that is with these panel combinations, because then you're basically looking at the individual and doing a comprehensive screen on them to see what is going on, rather than specifically targeting what you may suspect. But you may have it wrong and you may miss because they've taken a different drug or a different combination just before you're screening them. Okay, so I hope that's a little bit helpful and helps in terms of guiding you where you should be looking in terms of testing when you're considering this in schools, particularly in residential schools where these tests can be added in as part of the regime for screening, particularly if you are allowing elder teenagers access to pubs or clubs as part of their sort of sixth form or upper sixth curricular activities, and you don't want a dormitory issue with drugs of abuse being rife. Okay.